Welcome to week 2. My name is Angela Goodridge, and I'm your nursing instructor for the Nursing Assistant Training Program. It's my pleasure to present to you the learning objectives for week 2. We are going to look at chapter 6 through 10, and we would look at the various learning objectives. Here at this point, I would present to you the learning objectives for all these chapters, and you would find in your week 2's tab there are learning objectives and a PowerPoint there for you. You would see that there's also your online textbook and workbook, and therefore remember that you have to read your chapters, and there is a workbook assignment after each chapter, and you'll take a picture of your workbook assignment that you have completed and upload it to that tab, and then there will be a chapter test after each chapter, and your instructor will grade that test, and you'll continue from chapter 6 through 10 and until you've completed that portion. So you would have completed chapter 1 through 5 in week 1, and now there is chapter 6 through 10 in week 2, and week 3 you would come into the school for your labs, and through week 4 we'll conduct our clinicals, and then one more day where you'll come in for your skills exam and your written exam from the school. So again, welcome to week 2, and my name is Angela Goodridge. Now, in chapter 6, we will go through personal care of the resident. This chapter is called Personal Care Skills. So in this chapter, we'll explain personal care skills that you would perform. We would identify guidelines for providing skin care and preventing skin injuries like pressure sores, bed sores they're called, sometimes decubitus ulcers. So we'll talk with you about that and what you as a caregiver can do about that and preventing that from happening. We will talk about some of the guidelines that you can do, like bathing the patient, turning the patient, making sure the linen is clean and dry and wrinkle-free. We will describe guidelines for assisting with bathing. We will describe guidelines for assisting with grooming, such as their hair care, their nail care. We will discuss guidelines for assisting with dressing. You would learn about dressing the affected side and the unaffected side, and about giving the patients choices. Patients must be given choices when they're dressing. We don't just go to the closet and pull out what clothes we think they want to wear. We have to involve them in that choice. And we will talk about providing oral care like mouth care and denture care. We will talk about toileting, various aspects of toileting, giving a patient a bedpan, a urinal, a bedside commode, or taking the patient to the toilet. We would also explain guidelines for safe positioning and moving patients, ambulating the patient. So all that you would read in chapter 6. In chapter 7, we will talk about basic nursing skills, such as monitoring the vital signs, temperature, pulse, respiration. So in chapter 7, you can read all about that, the parameters, normal values, various ways of checking the blood pressure, or various ways of checking the temperature, like oral temperature, or by the air, or temporal. By the air is called the tympanic method. Or a patient can have their temperature checked under the arm, the axillary, or rectal temperature. So various ways of checking the temperature, and you'll also learn that pain is also another vital sign. So we'll learn about that. We'll learn about admission, transfer, and discharge processes. That's some skills that are involved there, and you can help as a caregiver with that. We will talk about measuring the height and the weight and various restraints that can be used. Now, restraints can probably be used in the hospital with a doctor's order, but we try not to and do not use restraints in the long-term care environment like the nursing home. But you would learn about creating a restraint-free environment where we will lower the bed, put mats on the floor, make sure the patient's call light is within reach, and checking on that patient very often to prevent the use of restraints. We will talk about fluid balance and monitoring the patient's intake and output. We will show you how to do that. We will explain care guidelines for catheters, Foley catheters, indwelling catheters, straight catheters. We'll talk about that. And of course, there's explanation of those skills in the reading. Chapter 7 and Chapter 6 are very important chapters, and much of that content is on the state exam. We'll also talk about care, explain the care for patients on oxygen therapy or IV therapy. There's still some that the caregivers, CNAs, can do to assist when the patient have those two things going on. We will discuss the resident unit and all those components of the resident unit, like the bedside table, the overbed table, the bed, the call light, the privacy curtain. Those are things that can be found in the resident unit. We'll talk about that, and we'll explain in Chapter 7 the importance of sleep and providing the patients a comfortable sleep environment and what you as a caregiver can do. So you can read about that in Chapter 7. Also in Chapter 7, we'll talk a little bit about the dressings. We don't do a whole lot of dressings. CNAs don't do a whole lot of dressings, but you may reinforce a dressing. But after CNA is completed, after your exam, some facilities like assisted care environment can teach the caregivers how to perhaps perform a simple dressing, but no sterile dressing. So again, Chapter 6 and 7 are very important chapters. In Chapter 8, you will see nutrition and hydration. Chapter 8 is about feeding that patient, identifying the basic nutritional needs and the basic nutrients that the patients will need. You'll also learn about MyPlate.gov. That's a government initiative that talks about the kinds of foods that people should have, and so it relates also to the elderly. We'll talk about various food preferences. Sometimes patients have food preferences according to their cultures, or some patients may have food preferences because of the disease process, like a patient with a stroke might be able to eat a pureed diet rather than a regular diet. So we will discuss how to feed residents, and those steps are all in the book in Chapter 8, and you would want to read that. And about maintaining patients' fluid balance, that's there in Chapter 8 as well. We would list different ways to identify patients with weight loss. Weight loss can be critical. It can be intended weight loss or unintended weight loss. So we as caregivers have to monitor that closely, because sometimes the doctors want the patients to lose that weight. Sometimes we don't want the patient to lose that weight. So we would monitor the patients well. So you would read about that and how to monitor patients like that. We will talk about, in Chapter 8, we will identify ways to promote appetite and to help patients at mealtime, making sure the patient has good hand washing, good mouth care, good incontinent care, that they perhaps are sitting with their friends or people who are just like with similar disease processes. Dementia patients might sit in one area. So those are ways to promote appetite and make mealtime more pleasant. We will talk, of course, about some symptoms or problems that patients may have. Symptoms like swallowing difficulties or dysphagia or pocketing food. So we'll talk about that, some signs and symptoms that you can identify when feeding, and certainly how to report that. We'll also talk about, in Chapter 8, different special needs the patient may have: visual impairment, hearing impairment, or mental health issues that the patient may have that influences or impacts the way they eat. So you can read about that, or will read about that in chapter 8. In chapter 9, it's about rehabilitation and restorative care. So rehab is to get that patient back to their normal or an acceptable level of functioning. They may not get back to their norm, but they can get to a point where they can now perform. So rehabilitation is about that, and restorative care is the care after rehab. So we'll discuss rehabilitation and restorative care. Chapter 9, we will discuss the importance of promoting independence and activity once more. You would have heard that mentioned in week 1, the importance of maintaining independence and activity. And you would also discuss ambulation. How does a patient get around? In a wheelchair, using a walker, using a cane, crutches, or a C cane or a quad cane, using of the gait belt. So there are some steps to follow. We will talk about dangling, where the patient sits on the side of the bed before they get up and start walking. In chapter 9, we will talk about some of the assistive devices and protective devices that we can use to help the patients, and different range of motion exercises. The book goes through many range of motion exercises, and that's all good preparation for your state exam. We will also talk about amputations and prosthetic devices. Some patients may have a foot or leg amputated, and now they have to wear a prosthesis. So we'll talk about that, care of the prosthesis. We'll read about that, the guidelines to follow for patients with prosthetic devices. And we would also talk about assisted the patient with bladder and bowel retraining. So chapter 9, the last aspect, is about bladder and bowel retraining. So we'll talk with you about that, and we'll discuss the guidelines. Chapter 9 lists some guidelines to follow. In chapter 10, it's called Caring for Yourself. That's the last chapter of the textbook. And so it talks about jobs and how to find jobs and the various resources to use in finding a job. It also talks about a job description, what to do for an interview, some guidelines for an interview. So you would read about that, how to manage your time and how to manage your assignments, and how to care for yourself when you start to work. Nursing assistant work is very challenging. It can be hard on you if you're not taking care of yourself. It's very rewarding. And always remember that the nursing assistant is the eyes and the ears for the nurses. So they are more at the front line caring for the patients, and the information they provide are so important. So you have to take care of yourself as well. We would talk with you, or you would read about managing conflict in chapter 10, how to manage and resolve conflict, how to face important matters, how to discuss or present, or how to follow your chain of command. We would also talk about evaluations, employee evaluations. When you start to work, you'll get evaluations. Sometimes you get an evaluation the first 90 days or the first year, and how to accept constructive feedback after your evaluation. And we will talk about the recertification process. Each state might be different, so you have to follow your state's guidelines for recertification. Usually it's 2 years. And how to continue your education. As a CNA, you want to continue your education, and how we'll talk with you about the registry and following guidelines from the registry, and also how to manage stress. Very importantly, chapter 10 talks about caring for yourself and how to manage stress. So it does highlight some reasons for stress, why stress can occur, and what you can do as a caregiver. So it's a very important chapter to read. Remember, after each chapter, there is a assignment. So you have to read your chapter. We have the PowerPoints there for you as well. You would read your chapters. you would complete the workbook assignment. You'll take a picture of your workbook assignment and upload that to the website, to the assignment tab, and then you will complete your exam. You have to follow each step after step, and the instructor will continue to monitor. In some cases, you will have to wait for the instructor's response before you can move forward. And so you complete your chapter test, and at the end of the whole 2 weeks, you will get a certificate that states you have completed that portion. After that's completed, you would want to return to continue your program at the school, where you will do the lab portion of your class. After that week, you will be prepared and prepped for your clinical assignment, whereby we'll go into the clinical site and implement the skills that you've been checked off on in the lab. And at the end of that week, you will return to the school to complete your skills exam and your written school exam. So that's how our blended program will be conducted. Thanks very much for your participation in this week 2's announcement. Please remember to give us a call. You can come in or send us an email to answer any questions or concerns that you may have. Thank you very much. Have a safe journey.